Welcome to Ambition's Apex, your guide to mastering the art of physique transformation and achieving peak performance across all arenas of life. Our mission is not just to sculpt bodies, but to change lives, empowering you towards excellence. Dive in with us as we explore insights and strategies designed to elevate you towards your journey of self-improvement. Enjoy the ascent. Welcome. The year is now 2026. I hope everybody has had a great start to their year. It's been a while since I've recorded one of these. My plan for the year is to pump out at least one episode per month. Now, they may be long, they may be short, it may be solo, maybe with a guest, but regardless, I'm going to provide high-level value for you guys and just putting some information out there and having fun with it. So today's topic of conversation is hair loss. And if you've been rocking with me for a while, this kind of goes without saying, but if you're new here and you don't know who I am, this is for educational purposes only, and this is not medical advice. I'm not a doctor, so let's get into it. So I want to be clear from the start. This is not going to be a simplistic conversation. Hair loss is one of those topics where the internet tends to flatten a very complex biological process into a couple buzzwords. And, you know, like most things, it requires more nuance. It requires dissecting the context and understanding things a little bit more deeply. What I'm going to try to do today is to break things down in a way that is understandable, maybe not too convoluted, but also providing enough nuance and discussion where we can understand this on a deeper level and understand where these things may be coming from, because it's not as simple as it's just genetics, it's just DHT. It is more complex than that, and there is truth to those statements. You know, DHT and genetics are definitely a driver, but those claims are incomplete. So hair loss in most people reflects an interaction between genetic susceptibility and systemic physiology. Hormones matter, stress matters, inflammation matters, nutrient status matters, and local scalp environment matters. So there's a lot of things to take into consideration here. For people pushing performance, whether it's high levels of training intensity, we're dieting hard, in deep deficits for long periods of time, high levels of systemic stress, work stress, relationship stress, performance enhancing drugs, stimulants, all these different things, all these variables tend to stack here. So instead of talking about hair loss as a single cause problem, today we're going to approach it as a systems level phenomenon where different inputs raise or lower the risk over time. So hair follicles are pretty sensitive to stress. Let's understand why. A hair follicle isn't inert tissue. The visible hair shaft is non-living, but the follicle itself is metabolically active and biologically dynamic. It contains a stem cell niche, undergoes rapid cell division during growth phases, and depends on adequate blood supply, oxygenation, and signaling. Because of that, hair follicles tend to be sensitive to physiological stressors, as I mentioned. This is one of the reasons that hair changes are often noticed during or after long periods of illness, calorie restriction, hormonal shifts, or significant psychological stress. Importantly, hair growth is not essential for survival. When the body reallocates resources under stress, hair growth is often deprioritized before other critical systems. So I talk about this a lot. I've talked about this with like the pregnenolone seal, for example. When the body is under chronic stress, it needs to reallocate resources for survival. So this goes towards, we can talk about hormones, we can talk about a lot of things, but today specifically we're talking about hair. And hair is relatively unnecessary when it comes to high-level survival states. That framing is useful not as an absolute rule, but as a general principle. Hair follicles cycle through three phases. So we have anagen, the growth phase, which on the scalp typically lasts several years. Catagen, a short transition phase lasting weeks. And telogen, a resting phase that usually lasts a few months before shedding occurs. At any given time, the majority of scalp hairs are in anagen, while a smaller percentage are in telogen. Variations in this balance are normal. Hair loss can occur through different mechanisms. A shift in the hair cycle, where more hair enters telogen and shed, or progressive follicle miniaturization, where the hairs become thinner and shorter over repeated cycles. So we're going to dig deeper into that a little bit later on. These processes can occur independently or together. So we can have like one or the other, or we can have them both occurring at the same time. Distinguishing between them matters because they respond differently to intervention. So again, we need to understand the nuances of this so we can approach it appropriately when we are trying to figure out what's going on and how to treat it essentially. Broadly speaking, most people experiencing hair loss fall into one or both of these categories. So we have diffuse shedding, often referred to as telogen effluvium. This typically presents itself as increased shedding across the scalp, hair coming out during washing or brushing. So you may be brushing your hair, washing your hair, and seeing a lot of hair on your hands or in your brush. A general sense of thinning rather than localized recession. Telogen effluvium is often associated with psychological stressors, physiological stressors, things like illness, major life events, nutritional deficits, medication changes, or hormonal shifts. Importantly, telogen effluvium commonly appears weeks to months after the triggering event, which can make cause and effect difficult to recognize. So this goes into understanding where the root cause is coming from. Like if you go through a breakup or a stressful move or you lose your job or anything of that sort, sometimes the stressors that you experience, the negative impacts of that will be kind of delayed and you won't see those for a while. And oftentimes when we have chronic stress where it's just like really placed on the system consistently over long durations of time, these things can start to manifest longer. So sometimes it's like a really stressful event and we'll see it long term, or the chronic stress is leading to this kind of accumulation, if you will. The second one that we'll see is pattern hair loss. So this is going to be androgenic alopecia. This typically presents as recession at the temples. So I've had a little bit of that myself. Thinning at the crown, fortunately I have not had that. And then gradual changes over years rather than weeks. So this is going to kind of occur over time. This pattern is strongly associated with genetic susceptibility. So oftentimes, if you have, for example, if you're a male and you have a father that has gone bald pretty easily, or grandparents, and balding is just a common thing within your family, that may be something that you're experiencing as well, and it just kind of lines up. So genetic susceptibility and androgenic signaling, particularly in scalp regions sensitive to dihydrotestosterone, which is DHT. And additionally, if you're using performance enhancing drugs, this is a common side effect when it comes to using DHT derivatives, things like Anavar, Primo, Masteron, et cetera, et cetera. However, even here, the rate of progression and severity vary significantly between individuals. Everything is bio-individual, guys, everything. So the way that everybody responds to stressors, performance-enhancing drugs, whatever it may be, the way that we respond to things is going to be very individual to that specific person, the context. There's just so many things to take into consideration when it comes to understanding that. And the way that these things manifest is just going to vary drastically. Androgenic alopecia is associated with androgen signaling, especially DHT. DHT is formed from testosterone via the enzyme 5-alpha reductase, which I talk about pretty often. In genetically susceptible scalp follicles, DHT signaling is associated with progressive shortening of the growth phase and follicle miniaturization over time. That said, DHT alone does not fully explain hair loss patterns. As we've mentioned, there's multiple contributing factors here, especially depending on the individual and what's driving it. Many individuals with normal or even elevated androgen levels retain hair, while others with similar hormone levels experience significant loss. This suggests that local follicle sensitivity, receptor activity, inflammatory signaling, and scalp microenvironment play important roles. A useful way to think about this is that genetics and androgens set a baseline risk, while systemic and local factors influence how quickly or severely that risk manifests. This is particularly relevant in populations exposed to supraphysiological androgen levels. As I mentioned earlier, individuals that are using performance-enhancing drugs, specifically DHT derivatives, such as some strength athletes or bodybuilders, etc., anybody just trying to have that kind of extra edge when it comes to performance, where risk may be amplified, but still varies widely between individuals. Now, stress, both physical and psychological, can influence hair cycling. Chronic stress is associated with alterations in cortisol signaling, sympathetic nervous system activity, sleep quality, and inflammatory pathways. These changes can influence blood flow, immune signaling, and tissue repair, all of which may affect hair follicles. In telogen effluvium specifically, stress is a well-recognized contributing factor. This does not mean that stress automatically causes hair loss in everyone. Rather, it increases susceptibility, particularly when layered on top of other risk factors. So, like I mentioned before, multiple contributing factors are usually the case. For individuals operating under chronically high stress, whether from training, work, calorie restriction, or lifestyle instability, hair changes may reflect cumulative load rather than a single cause, multiple contributing factors. So both systemic inflammation and scalp inflammation can influence hair health as well. Conditions like psoriasis, for example, involve inflammatory changes in the scalp that may interfere with optimal follicle function. So a lot of individuals, when they have psoriasis, will get it on the scalp, temple area. There is evidence that antifungal and anti-inflammatory treatments can improve certain hair parameters in some individuals, likely by improving scalp environment rather than directly altering androgen signaling. So a lot of times when we talk about hair loss, we immediately jump to DHT and focusing on shifting that signaling, whether it's localized or systemic. But a lot of times, like I mentioned, if there's other contributing factors like inflammation here, we may be able to kind of see improvements without having to jump to that conclusion. This does not mean that inflammation is always the primary driver for hair loss, but it can be a modifying factor, particularly in individuals with underlying androgen sensitivity. Hair growth is energy dependent. Periods of low energy availability, such as aggressive dieting, contest prep, illness, or prolonged underfueling, have been associated with increased risk of diffuse shedding. So if you're in contest prep, for example, and you're losing your hair, it may not just be the DHT that's driving that. It could be a lot of different things, including just the general systemic load or calorie restriction that's driving it as well. Micronutrient deficiencies, including iron deficiency, vitamin D deficiency, zinc deficiency, and others have also been associated with hair changes in certain populations. However, supplementation alone is not going to reliably reverse hair loss unless there is an actual deficiency present, because if there isn't a deficiency present and you're just tossing supplementation at it, it's not really doing much. A more useful framework is overall metabolic adequacy. So sufficient calories, adequate protein, stable blood glucose, and blood sugar levels, recovery capacity aligned with training and stress load. Hair loss in these contexts is not a moral failure or lack of discipline, it's a biological signal. So let's talk about interventions here and what they can and cannot do. So DHT modulating therapies are going to be the most common ones that you hear. Usually this is the one that people jump to if they're losing hair. So medications such as finasteride and dutasteride reduce DHT levels by inhibiting 5-alpha reductase, which I talked about earlier, the enzyme. These medications have demonstrated efficacy in slowing progression of androgenic alopecia in many individuals. However, they also carry potential side effects and responses vary. So as I mentioned, if it isn't an androgenic alopecia driven hair loss issue, then you may be just getting side effects here and not be fixing the problem. Topical finasteride has shown promising results in reducing scalp DHT with lower systemic exposure in some studies, though long-term data is still evolving. So when it comes to finasteride and dutasteride, we commonly see topical or systemic, and topical is usually a better go-to because we're not going to have those systemic issues that may manifest as far as side effects go. These medical decisions should be approached thoughtfully, not reflexively, as I mentioned, so we're not just jumping to conclusions here. So minoxidil is another one that you'll commonly hear of and is associated with prolonging the growth phase and increased hair density in some individuals. Again, in some individuals, because we need to know where the trigger and the root cause is coming from. It does not address androgen sensitivity directly and is often more effective as part of a broader strategy. So again, running some level of protocol, addressing the overall context of what's going on with this specific individual, and then kind of maybe building some sort of protocol that's addressing multiple causations at once is probably going to be the best move, in my opinion. Scalp care and recovery, improving scalp health, sleep quality, nutritional status, and stress management does not cure genetic hair loss, but may improve outcomes and reduce compounding factors and maybe kind of delay the onset of it to an extent as well. So a few things to ask yourself. Is this sudden diffuse shedding or is it gradual pattern thinning? Have you seen it over a delayed period of time or a prolonged period of time? Or is this something that seems to be more acute? Did a psychological or physiological stressor occur 2 to 3 months prior? So did you have something really dramatic happen 2 to 3 months prior to experiencing the hair loss? Are calories, sleep, and recovery adequate? Did you go through a contest prep recently, et cetera, et cetera? Is there more scalp inflammation or irritation? Are you experiencing inflammation? Do you feel itchy in the scalp, et cetera? Is intervention being chosen based on diagnosis, or is it panic? So not just jumping to conclusions here, as I mentioned. Hair loss management works best when it is diagnosis driven, not fear driven. So we don't want to jump to conclusions. We don't want to just start punching stuff into ChatGPT or Google and then getting fearful of what's going on, just like we don't want to do that with anything else and start self-diagnosing. I do recommend going to doctors when it comes to this stuff, or working with a very high level coach that can help you figure out where it may be stemming from so you can get accurate treatment. So hair loss is rarely caused by a single variable acting in isolation, and that is the answer you're going to get when it comes to most things in the human body. And if you're looking for black and white, just absolute answers, I am not the person to be talking to. If you want reality, this is the podcast to be listening to. I'm the person to be getting information from, because I love nuance, I love context. And you may be leaving the conversation maybe a little bit confused. It may feel a little bit convoluted. But if you can understand it on a deeper level and we can have some paradigm shifts here, it's going to be helpful in terms of overall how you look at things. And we want to try to simplify things so that we can educate appropriately and so that you can understand it, which is what I'm trying to do here. And hopefully you took some valuable information from it. So hair loss also reflects an interaction between genetics, hormones, stress physiology, inflammation, and recovery over time, as I mentioned. Some factors are modifiable, some are not. So for example, with genetics, sometimes there's just nothing we can quite do about it. And honestly, in my honest opinion, if you want to know, if you genetically have hair loss that is occurring and you've tried to address it and you're still getting hair loss, sometimes, just embracing the baldness is not the worst move. There's a lot of handsome dudes out there that are bald, and, I don't see a problem with it. But if you want to do like hair transplant, that kind of stuff too, that's specific to the individual, and I support whatever makes somebody happy. So, sometimes these things, interventions are not going to necessarily work for you depending upon your situation. So always take that into account. The goal isn't perfection. It's informed decision-making, realistic expectations, and minimizing unnecessary damage while aligning interventions with your actual priorities. So again, this is all bio-individual, specific to the individual, and most things are. If you want, I can follow this episode with a deeper dive into labs, clinical markers, and how I think about hair loss in high-performance clients. Just drop comments wherever you can, and let us know what you want to hear next. If you want to hear something else, just let us know. This was pretty all-encompassing when it comes to hair loss, for the most part, without any too many specifics or anything. Until then, stay rational, stay curious, and don't let the internet push you into extreme decisions without context. I will see you guys next time.
Thank you for joining us. Your journey towards excellence does not end here. We're here to help guide you every step of the way. For more insights and to become a part of our community, follow and subscribe. Your feedback illuminates our path. Be sure to share your thoughts and stay tuned for more episodes.